Welcome, everyone. I'm Judy Graham, and I write the Navigating Aging column for Kaiser Health News. Today, we'll explore a compelling question. How are older adults doing at this point as we enter the third year of the pandemic? It's a very confusing time. All over, we hear calls to return to normal. But what does this mean for vulnerable older adults with underlying medical conditions? What does normal look like, given everything people have been through over the past 2 years? We're grateful for the John A. Hartford Foundation's support for this event. Ronnie Snyder, Vice President of Program at the Foundation, on to you.
Thanks so much, Judy. Hello to everyone. And many thanks both to you, Judy, and to Kaiser Health News more broadly. The John A. Hartford Foundation is really proud to support today's event and the KHN reporting desk that covers aging and health issues, because this is so important to us. As Judy mentioned, I'm Ronnie Snyder, Vice President of Program at the John A. Hartford Foundation. We are a nonpartisan national philanthropy that's based in New York City. And our whole mission is devoted to improving the care of older adults. So we work in 3 main areas to do that. Creating age-friendly health systems, supporting family caregivers, and improving serious illness and end-of-life care. And you can hear how interrelated those 3 areas are. We are so happy to be here today to join this important discussion on the experiences of older adults during this pandemic, and what I think all of us, whether we're patients, family caregivers, clinicians, family, can do to support older adults moving forward. So at the end of 2021, 75% of people who died of COVID-19 in the US were 65 years or older. Social isolation and loneliness had a really devastating effect on older people who were more at risk of infection and hospitalization. And that's whether we're talking about people in nursing homes or in houses or in apartments. Older people experience the pandemic in particularly brutal ways sometimes. So it's really important today that we get to hear the voices of older adults directly, people from all over, in order to understand the needs in our communities and how to prepare our aging nation for the next pandemic or another emergency should something like that occur. And importantly, and I love this part of today's discussion, we can also learn from older people in our communities about what does work. A lot of older people have shown incredible resilience during the crisis. And today, we're going to hear from this fantastic, very diverse panel with diverse experiences to shed light on their sources of support and strength, in addition to some challenges. So that diversity of experience and background is one of the reasons I'm really excited to hear from our panel themselves. We know that the pandemic disproportionately impacted people of color. And we know that where you live and your income and what health conditions you have also play an incredibly powerful role in determining how each person has fared over the last 2 years or more. So you're in for a really lively and rich discussion today with this group of panelists who have such different stories to share. Big thanks to everyone for joining us today, and we hope that you will continue this conversation with the John A. Hartford Foundation and with Kaiser Health News into the future. So back to you, Judy, an extraordinary journalist who writes the Navigating Aging column for Kaiser Health News. Thank you.
Thank you, Ronnie. I appreciate it. As Ronnie said, this is all about hearing from older adults about their experiences. Our panelists, 9 of them, will be looking over their shoulders back into the past and forward into the future. I'm going to let each of the panelists introduce themselves. And then after they do so, I'll go around and ask at least the first round of questions. If you have questions, please submit them to the Q&A function at the bottom of this Zoom screen. And we'll be monitoring that throughout this 90-minute event. Also know that a recording of this event is going to be sent to all the people here today, a link to that, as well as it will reside permanently on the Kaiser Health News website. All right, enough with the introductions. On to our panelists. Deirdre, can you introduce yourself, please? Deidre, you're muted. Please unmute. Okay, start again.
Hi, my name is Deidre Nottingham. I live in Fort Greene in the Stonewall House, and I'm 71 years old.
And it should be said, Fort Greene is in Brooklyn, New York.
Yes, it's in Brooklyn, New York, downtown. Sorry about that. Yes, I just moved here 2 years ago.
Chuck, can you introduce yourself?
I do. Thank you so much for having us here. My name is Chuck McClatchy. I live in Las Vegas, Nevada with my partner, Bobby. We live in a adult apartment complex, and I was diagnosed with Alzheimer's 8 years ago.
And how old are you, Chuck?
I'm 69.
Great, thank you. Walitha, you're next. Please introduce yourself.
Hi there, I'm Walitha King Barnett. I'm 69 years old. I live in Durham, North Carolina in a small bungalow, and I do have a housemate.
And I think that might lead on to you, Harold Barnett. And please
My
introduce
name's Harold my name's Harold Barnett. I'm 70 years old, live in that same bungalow that I share with Walitha, who is my ex-wife and my current business partner.
That's absolutely amazing. We'll hear more about that maybe. Lenny, can you please introduce yourself?
I live in Minneapolis. I'm 80 years old. I was born in Holland during the war. I'm a retired psychologist and I live alone in a single family dwelling.
Thank you, Lenny. Hector.
My name is Hector Flores. I'm a diabetic and I live in Dallas, Texas. And I live in a two-story home with my wife. We've been here about 37 years.
Thank you, Hector. Glad to have you.
Likewise.
Maurice.
My name is Maurice Miller. I'm 59 years old. I am a stroke survivor, currently living in a nursing home in Tacoma Park, Maryland.
Thank you, Maurice. Janice.
Hello, everyone. I'm Janice Scholler. I'm 74 years old. With my husband, Tom, I live in Erie, Pennsylvania at an Asbury continuing care retirement community, which is called Spring Hill.
Thank you, Janice. And Tom.
My name is Tom Scholler. I share the house with Jan. We live in a two-family dwelling, like a twin rancher in a CCRC. We've lived here for 4 years, having moved from Philadelphia. So 2 years with COVID, 2 years without. I'm 78 years old and Jan is 74.
Thank you, everyone. I'm so excited to speak to all of you. Deidre, you're going to have my first question. You're an LGBTQ senior who lived through the AIDS epidemic. You told me in advance of the panel that this pandemic reminds you of the AIDS epidemic every day, that it's a trigger. In what way? How does it make you feel?
Isolated and afraid to be around people, and sometimes lonely. It reminds me of AIDS epidemic. Nobody didn't want to talk to nobody or talk to anybody. And it's very depressing. And when you're isolated in the house, since I live alone, I do feel like that sometimes, like I'm back into that era, you know, nobody to talk to. We have to wear a mask all the time, which is similar to back then. You know, a lot of my friends died back then and nobody didn't want to be around them, you know, but I still miss them. You know, I love them, you know. So right now, I'm missing a lot of people right now being isolated with this pandemic. Yes.
Have you lost people during this pandemic as well?
Yes, I've lost about 6 people, family, relatives, and it's really a hardship, you know. And then I had to do funerals on Zoom with 2 of my aunts. So it's very heartbreaking, very, you know. And It's just heartbreaking.
We'll come back to that. Thank you. Chuck, you have dementia and you run a weekly Zoom meeting for people with dementia. What's the pandemic been like for people living with dementia?
Well,
And for you, of course.
yeah, it has isolated so many people, and people living with dementia, the worst thing that can happen to them is for them to be isolated. They decline faster. There's been a 20% increase in deaths during COVID with people living with dementia. We've had people that have really struggled. I have one friend that he had just put his wife in a care facility right before the pandemic. She has severe dementia, and he could not go see her for over a year. And it stressed him out, it stressed her out. She almost completely forgot who he was. And people, just the isolation part is the worst thing you can do with somebody with dementia. So, we have ways of trying to keep people involved, trying to keep people connected, with other people, just to be able to talk about this pandemic has been so divisive that people don't understand what they're listening to. They don't understand who to believe. Is it real? Is it not real? Is it this? Will the shots help? Will they not help? And every time you turn on something, it's one severe side or the other. And there seems to be kind of no middle ground. And people with dementia, we are already stressed. And now you put the pandemic on top of this. And I've seen, I've lost quite a few friends and stuff during the pandemic because they had the underlying conditions, with health problems. And even though they were inoculated and everything, they did pass away. So, you have to deal with other, with friends and stuff passing away also. And it's just, I know that a lot of people have declined during this pandemic because of the isolation, the stress, not understanding the deaths, in the care facilities, not understanding why you're there, because you can talk to nobody, you can, your family can't come and see you. And a lot of people with dementia, they don't understand why they're there. Why aren't they home? And there's nobody, no family member that can go in and talk to them. And it's just been extremely stressful on everybody.
What's been hardest for you, Chuck?
I think just the stress of, basically not knowing who to believe. Is this real? Will the shots help? Luckily, Bobby, and I have, we do our own kind of little research and everything. And we kind of listened to nobody on either end. We stayed in the middle, and we protected ourselves as much as possible. I know that when the pandemic first came out, we went to the store for something and I had to leave. I couldn't take the pressure of being in there with everybody with, masks on, bumping into each other, trying to hoard food, and the stores were just a mess. And it took probably 5 or 6 months before I could even go to the store. And my stress level was still extremely high. You're not allowed to do the things that you normally do, which creates more stress. And luckily, my safe spot was with Zoom. The group I work with, DAA, we were using Zoom luckily before the pandemic. So we relied on it to still, do our social engagements. And I think that's what has kind of gotten me through. And, providing that for other people helps them get through this. For anything that you're afraid of, but yet you can have a group to talk about, kind of relieves a little bit of that stress. And, you can tell yourself, oh yeah, I know that they're going through more than I am, or maybe I can help them or they can help me. And just the interaction that people need to get through this.
Thank you, Chuck, so much. And DAA refers to Dementia Action Alliance. Walitha, you're next. You're immunocompromised and recently had major surgery. Can you tell us about that? And how at risk do you feel at this moment of time?
I feel very much at risk. I mean, a COVID infection could put my life on the line, and that's actually not an exaggeration at all. I actually, over the past 3 years, have been hospitalized twice, early on for a week, and just recently, I had major surgery on the 7th of February and was just released from the hospital this past Friday. I actually had I had an ileostomy. I had my colon removed as a result of having Crohn's disease for over 40 years. So the advice for those of us who are immunocompromised has been contradictory. It's been confusing. You don't quite know what to believe and who to believe. I am immunocompromised because of taking or juggling 4 or 5 biologic drugs. So my doctors have been confused. I am still not fully vaccinated and boosted. So yes, Judith, I feel very much at risk.
So how do you make decisions about moving out into the world or not? Are you staying at home? Are you isolating yourself? And how do you feel as we, quote, return to normal in the rest of the world and people like you aren't sure what to do?
I make decisions on a daily basis, all right? I do go to the store. I go to the grocery store. I go to the pharmacy, not as often as I used to. I am always masked. If I sense that grocery stores or pharmacies are crowded, I don't go in. I don't go out to dinner. I don't go to movie theaters. There are many areas that I've simply dropped from my life. But I make up for them in other ways. So it's scary. My family has adapted based on my particular needs to the extent that we have actually had a cookout at a rest stop. Simply because, I mean, I know how that sounds, but that's what we needed to do. We needed to see each other. We needed to be outside. So we played cornhole and we cooked some burgers. It was fantastic, okay? It just relieved some of the stress for all of us. So I used to walk, Judith, for exercise. I love walking. I used to walk 5, 6, 7 miles a day. I can no longer do that. But now I walk for therapy. And it works for me.
All right. A question has come in for you, but I'm just going to go through this first round of talking to everybody first, and then I'll bring forward some of the questions. Harold, tell us about, you had mentioned to me earlier that you and your family feel shut out as healthcare converts to a everything online format, and that this is particularly an issue for older adults during this pandemic. Can we talk about that and the kind of barriers that you and other older adults in your circles are facing?
Yeah, until very recently, I've been exceptionally healthy and hadn't had a lot of experience with the healthcare system, just regular checkups and all that. My numbers were always good. And my attitude toward the healthcare system was pretty much neutral. I didn't think it was great. I didn't think it was terrible. But for me, the pandemic just really emphasized the inequality and inequity of the healthcare system. For context, I grew up in the South during the 50s and 60s. So I grew up under segregated healthcare, when laws dictated which skin color had access to quality care. Today, to me, this sudden shift to this high-powered digital technology without any preparation of the healthcare consumer, many of whom are, poor or minorities without resources or older people, they have limited mastery of this technology. And to my mind, this heavy duty technology and this demand that people conform to it is playing a role similar to the segregation laws. The technology just acts as a barrier to access. And although tech isn't a race specific barrier, I would say, people of color and older people especially are more heavily impacted by it. So all of this has shifted my view of healthcare from neutral to skeptical, during this pandemic period.
And how would you say, I'll ask you the same question I asked Chuck. What's been hardest for you personally?
I may be the exception on this panel in that my lifestyle hasn't changed that much during the pandemic. I have to be especially careful because I share a household with Waleetha, so I'm always masked, N95 or better. I've never been a person interested in mass events, going to basketball, football games and all that in person. I grow a lot of our food. I have a garden. I'm a great cook, which is why Waleetha doesn't have to go to restaurants. So I've never, been a big person about eating out. Go to, nice restaurants on special occasions. I'm an outdoorsy person, and there's plenty of room to space oneself out of doors. So my experience in the pandemic has been pretty much business as usual. I know what a pandemic is. I know what a highly transmissible virus is. So you just use common sense. I knew that when this pandemic was declared, it was going to be around for a long time. I just accepted that it was going to be here and that I would have to be aware and cognizant of the risk and behave accordingly. And I just accepted that things were not going to be the way that they used to be ever again. And so it's been sort of easy for me to get along with the parameters that have been imposed on us by the pandemic.
Really interesting. I'm glad to hear your perspective. Lenny, you're next. You told me you became really isolated last year when close friends withdrew into nuclear pods. Deirdre spoke about isolation. Can you tell us about your experience of isolation, what that was like, how it impacted you, and what you did about it?
Yeah, I'm an introvert. So like Harold, I am most of the time really comfortable spending a lot of time by myself, but I've always had a circle of friends and people I could share life with. Personal in-person connection is very protective. And I always had enough of that with my communities. What I discovered during the pandemic was that a number of families that I had been a part of for many, many years, when the pandemic came, they kind of closed into family pods that excluded single people. And so I found myself separated from people and communities that I had felt that I was a part of. And so what I did was create some very intentional communities that were largely of other single people, because I discovered that I was not alone, that what was happening with me was happening with people who were widowed or divorced or for whatever reason living alone. And so I created and co-created a couple of communities that met in person. And we were very careful about that. When the weather allowed, we could meet outside. When it got colder, we used heaters. And when it became very cold and we had to meet indoors, we used masks and social distancing, but we took some risks.
Can you talk about what the experience before you were able to put these communities together, what the experience of isolation was like for you? I think it brought you down for a while. Can you talk about that?
Yeah, well, it was scary. for the first time, I found myself not welcoming being alone as much as I usually did, because resources that I had counted on and always felt were there were no longer there. And so for a while, I became depressed. My energy dropped. My spirits dropped. I felt alone, a little bit abandoned. It hurt in some cases. And it took a few months for me to come out of that, to adapt to kind of a new normal, and to find a way that felt comfortable again.
And what was putting together the groups the key to your adaptation, or was there something else that you did that allowed you to adapt?
Well, I think a philosophical thing. I've written a book on groundlessness, and I grew up in the war. And so I had this sense of impermanence. It's always been with me, the sense of that things are always changing, and that the challenge is to deal with change. You know, how will you manage circumstances when they evolve and the security you thought you had is no longer there? And so I actually took that on as a personal challenge. And I felt, because it was so connected, it was really odd. There were so many ways that the war experiences corresponded to what I was experiencing now. And so it took some deep diving on my part, which I welcomed, actually. I thought of it as an opportunity to learn some things, or to relearn some things, or to understand some things in a new way. So there was a deepening in it that I value.
I think I'll come back to that, Lenny, but let's go on to Hector. Hector, you're deeply involved with the Latino community in Dallas, Fort Worth, and nationally. How has your life changed during the pandemic? Lenny just talked about the sense of upheaval. And I know that you too have experienced it. Can you talk about what you and those in your community have experienced in terms of changing relationships within, family networks and with friends?
Well, I think the most depressing thing is when they shut the doors on interaction with your immediate family, when you're advised that, any one of your grandchildren or your children could bring in this virus, and or even attending church. At our family, there's three things we normally do, and that's church, family gatherings, or being together and exchanging ideas about our experiences we had either on the job or at school or where have you. But I think one of the other important things is, since my wife and I are at an age that we're very vulnerable, I being a diabetic, my wife having a double mastectomy, and having to live on oxygen 24/7. So it was especially depressing in the beginning. And so slowly but surely we'll be able to overcome those things. It hasn't been easy. And prayer helped along the way. I know that one thing that I've continued to do, and that's the work that we do, the civic work, the food bank, and the meals and all those kinds of things we try to, we have several programs to feed needy families. And so that takes me out into the community. And I have to tell you that many of the, particularly Mexican-American community and Latino American community, they have to work every day. If you don't work, you don't eat. So they're exposed to this, and that you're cognizant of that. And many of the people that are here also without documents, they're afraid to go get vaccinated. They're afraid to go to a medical clinic where they're going to take their name and their address, afraid that the government's going to provide it to immigration, law enforcement type, and all those kinds of things. And I think that, thank goodness for Netflix on our part, and Hulu and other, that we've been able, and church on the tube. My wife is a viewer, constant viewer, that we don't have to go to mass anymore. We can do it at home. I continue to go to mass when it's been open, but we just don't have the same kind of social gatherings that we had with our children. It was always either a telephone call or teleconference or a FaceTime on the phone and or Zooming, believe it or not, because birthdays and accomplishments now, they're communicated to us and we all hook up. Not only our immediate family here in the North Texas area, but throughout the US where we have relatives. We have personally been touched. My first cousin died about 2 years ago in a nursing home, along with 8 or other people that in Austin. Just a week ago, my niece in Coraopolis, Pennsylvania, caught COVID. She was isolated at home in her apartment, so there was nobody there to see her give her last breath because her parents had also been ill and nobody could go visit her at the time. So these are things that I carry on my sleeve and in my mind. What could we have done better? And all we can do is try to pay attention to the science and the doctors that advise us. My wife and I are constantly viewing these different specialists. One thing that in this whole equation of services is the technology that you must know in order to be able to access them. I think one of my colleagues there made mention of that when we were doing orientation about how now everything has changed. If you do not know technology, you can't get an appointment. You can't put your name on the list. I think these are things that people are being impacted by, including ourselves. You know, you can't call in and they don't answer the phone, and you can't go visit the doctor. I mean, those things they're gone. The other one is the whole language barrier. I think that I have to put that on the table, that there is definitely a language barrier between provider and patient or victim. And that continues to be one of those things that we have to overcome.
Yeah, I imagine that it contributes to what Chuck called the confusion too, and in terms of sorting through information and getting through information. When language is added on top of that, the conflicting information people are presented with, it becomes even more difficult.
Absolutely, and I think as much as we get, of course, we have Spanish-speaking stations, all over the U.S., but I think that is an issue, and even. Just as the information flow gets out in different communities, sometimes it's only in English where people can access that information and utilize it for their family's benefits.
Thank you, Hector, so much. Maurice, on to you now. You're the only panelist who lives in a nursing home. Tell us about the home you live in and what the experience during the pandemic has been in the home. And then I have some follow-up questions after that.
Well, I live in a nursing home that's in suburban Washington, D.C. We are what's called a skilled nursing facility, which means that the residents require specialized care that they cannot get at home or in their retirement community. We are certified by Medicare.
Maurice, hold on 1 second. I think Hector and Deirdre, you're not muted. So if you can mute yourselves, we're getting a little feedback. Okay, please go on, Maurice.
Okay. We're certified by Medicare for 102 beds. The majority of those are devoted to long-term or what are called permanent residents. The rest are devoted to people who are here for rehabilitation purposes. People who have had surgeries, people who are heart attack survivors, stroke survivors, and have plans to transition either back home or to another facility because they have fewer needs once they recover.
How has the pandemic rolled through the facility that you live in, which you told me was majority minority?
Yeah, we are what I call a majority minority nursing home, which means that the majority of the residents, and as a matter of fact, the majority of the staff are people of color, largely people from the Caribbean region and also from Africa, and also people from the Americas. We went through 2 periods of what I would call fatal outbreaks during the pandemic. The first was early on, and it's difficult to get numbers on how many people were impacted because we changed management companies in the middle of the pandemic. So one management company reported to the state of Maryland their numbers on how many people got sick and how many people died. And then the new management company started all over and reported another set of numbers to the state of Maryland. Then in December of 2020, we had another outbreak where 40 people tested positive and there was 1 death. Keep in mind again, this is a 102 bed facility. So when you're talking about 40% of the population testing positive, that raises issues about whether or not you're being cared for properly and whether or not there are effective quality control measures to keep you safe.
You got COVID, if I'm correct. Tell us
Yes.
about when and how sick did you get?
New Year's Eve of 2020, I was admitted to the hospital on an emergency basis because of a severe gastrointestinal problem that the facility feared might require emergency surgery. I had at the same time started to feel disoriented and sick and kind of had an inkling that I probably had caught COVID. So it was not surprising to me when they did the rapid test at the hospital and it came back positive for COVID. So I spent a month in the hospital being treated for both conditions. I was fortunate physically in that my oxygen levels did not drop tremendously. There were only a few days where I had to receive supplemental oxygen. I received a large infusion of IV antibiotics, remdesivir, and all of those things. The experience itself, nonetheless, was excruciating because, how do I say this? COVID is not a department store condition where you buy it off the rack. COVID tailors itself for each and every person that gets it. So everyone's experience is different and everyone's experience is terrifying. That is why I have vowed to go to my grave, not revealing all of the details of my experience. I will say this, I spent a lot of time using my mind and prayer to try to make sure that I separated reality from short-term delusions. It was that intense, it was that scary. That's why when you ask the question about whether or not I felt, how was my care, I can't answer that because intermingled in all of that is the fear that I felt, the discomfort I felt dealing with my caregivers. And it's hard to unpack whether or not some of that was real and rational or whether some of that was just me being sick. And I just say this to people, as a result of my experience, I pray to God that I never learn to hate so much that I would wish COVID-19 upon my worst enemy. That's how severe and impactful that it has been for me. I lost a family member, and there have been people that I lost here in the facility, unfortunately, because I don't get around as much. I don't get to mingle and interact and talk to people. So many of the people that we lost here that I knew by name and reputation only. But it's a hard fight. It's still a traumatizing experience for me.
Thank you, Maurice. Painful, painful feelings. Thank you for sharing them. Janice, I'm going to move on to you. Questions are coming in, by the way, and I am prepared to, when we're done with this initial round, start asking some of them. But Janice, you too are immunocompromised. And how is this shaping your experience as the third year of the pandemic begins? What precautions are you following? How anxious are you?
I think I've been really pretty careful. Tom and I walk every day at the Mill Creek Mall, and we still mask up. We've been vaccinated and also boosted, and I read a lot to try to be current about what the best advice is in terms of keeping safe. For me, because the pandemic came after a really pretty stressful move from Philadelphia. The first year here in Erie was wonderful. I was becoming acquainted with new folks, and I think I had a more of a sense of optimism about the pandemic the first year. I felt this sense of, we were all in this together, and we have wonderful leadership here at Spring Hill. And while the vaccination rate was really pretty low, like about 40% of folks vaccinated here, the gal who was the executive director really kept us pretty safe. We have had some deaths, and I understand from the last town hall meeting we had that we now have more cases in the nursing section of Spring Hill. So I'm not sure if I answered your question.
Well, you said the first year was pretty good, and then how did things change?
I think there was this sense of it just never ending. I know enough about pandemics to know, and as a matter of fact, someone here who is a doctor said this is at least 3 years, maybe even longer down the road. I guess as it wore on, I began to feel more and more hopeless and really depressed and kind of anxious. There's a tremendous sense of lack of control, which for me is a theme of my life. So that was really rough. We've done some things to try. I find structuring my day is helpful to deal with the anxiety and also depression. But this just really seems to go on forever. And I have to admit that I just don't understand how people cannot do their civic duty by being vaccinated. So I have anger about that and feel a sense of lack of control. Mm-hmm.
Thank you, Janice. Tom, let me ask you. As Janice said, you moved into this community not long before the pandemic began. What have been the pluses and the minuses of being in a community? And your community is one with different levels of independent living, assisted living, and then skilled nursing care. What are the pluses and minuses based on your experience of being in a community like that?
Well, I grew up in this area, but I lived in Philadelphia for 50 years and we only came back 4 years ago. I guess I thought it would be very similar to what I left, but of course it's not. People are different. We have no relatives in this area. I have a cousin who lives in the same complex, but we don't see them that often. So it was difficult to, we hadn't made a lot of friends locally, at least in the complex. I tried to initially work with the structures that were put around us. We had to wear masks to go into the main building. We had our temperature taken, the whole 9 yards. Now it's only masks, but it's difficult to relate to people when you have to go through these structures. Unlike Jan, I refuse to be put in a shoebox where I can't get out. Just for my own sanity, even at the start of the pandemic, I would go to the grocery store every couple of days with no excuses. Of course, I wore my mask, but I just had to get out for my own sanity. She's not like that. She could stay here in the building, and I think it's affected her attitude, where she's not as optimistic perhaps as I am. I think I do see, after 2 years, some light at the end of the tunnel, that things might be getting better. Maybe we're approaching some kind of herd immunity, but I don't know if there are a lot of positives about this. I find it hard to even think of any positives other than getting to know your wife perhaps more than you ever had before in 52 years that we've been married. It is stressful to be with your spouse more often than you were before. Yeah. So I don't know if that answers some of your questions or not.
It's a common theme, the stress on relationships, not only spousal relationships, but other relationships of people stuck inside together. A question has come, and this was first directed at Walitha, but anybody on the panel can answer this. And why don't you just raise your hand, and I'll call on you. Do you feel that people are more supportive now, less supportive now of you personally? Do you feel that the nature of support that you get from those in your networks has changed during this pandemic? Does anybody want to take that on? Walitha?
I find that the people closest to me are more supportive than I ever would have imagined. And I also find that other family members think that I'm pretty paranoid. They, of course, are vaccinated and boosted, so they don't understand why they are not allowed to come into and out of my home freely. All right. But many of them don't understand that I am not fully vaccinated and boosted. I took one vaccine, discovered through a research study that I actually had not formed antibodies, but I didn't know that until 5 months later. So then I was eventually told that I could start with another vaccine, which has put me behind in getting boosted. That's a lot of information just to be sharing with people, and they don't necessarily seem to care. They've moved on, while those of us who are immunocompromised or have other vulnerabilities aren't really in that place of returning to normalcy.
Deidre, what about you? Are people more supportive, less supportive?
I would have to say less. Like the lady said, they moved on. They don't want to be bothered. And they know I live here by myself because my family's in Seattle. They just don't want to be bothered. Nobody calls, but thank God that my grandchildren, I have 5 granddaughters, they Zoom and they check on me all the time, and my daughter. But there's people around the corner, across the street. They don't even come by to say, how you doing? You want something from the store? And I feel like, I guess we were never friends, you know? And that's sad. They don't call or anything, and they're in connecting buildings and stuff, you know? But I made 2 friends in my building, so they checked on me this morning because I'm on new medication, so I'm blessed for that, you know? New friends is better, you know?
Well, everybody watching this, checking in makes a difference. Lenny,
Yeah.
you have your hand up.
Yes, because
Oh,
I
you're
just,
muted, Lenny.
oh, go ahead.
I found that some old friends disappeared, became very into their family cocoons. But there were other friends who unexpectedly reached out, and where we actually created some close connections that had not existed prior to COVID. So both.
Cool.
Anybody else want to weigh in on this one, or should we move on to another question that came in? If you want to weigh in, raise your hand. All right, we're going to move on to another question. What do you need? What would help your life? What would help you at this point of the pandemic and make your life better? Whether it's from organizations that are working with older adults or other sources. That came in from the audience as well. Who wants to raise their hand? Harold, you've got to have some thoughts on this.
Well, actually, I don't have very many thoughts on this subject, but I would say the one thing I can think of is something that I don't think is realistic. One of the things that the pandemic has done, in my view, is that it's clarified the core value driving our society and, by extension, the healthcare system, and that is competition, not cooperation. And we've evolved into this kind of Darwinian environment, you know, survival of the most adaptable. Unfortunately, people who are poor, people who are of color, and older people are among the least adaptable. So they've become the most expendable. If I had my druthers, you know, I would have someone wave a magic wand and take away that that attitude, which constitutes that core value, but that's not going to happen.
Chuck, what thoughts do you have about what would be helpful? What could help people in the communities that you are closest to, of people with dementia?
I think that one of the things that's severely needed is kind of what Harold just brought up. Dementia actually affects women and minorities more than white men, but yet, you know, the face of dementia is not what it used to be. And the only way to fight when anybody has dementia is to stay active. And I think groups need to be able to contact people, and if they don't have the technology, show them how to use the technology, you know, to be able to talk with somebody, to be able to interact, because isolation is the worst thing you can do. And there is a big disparity, just like, you know, Harold mentioned, of lower income not having access to computers. The federal government just now is making grants to have broadband in rural areas because Nevada is very rural, and we have, you know, Native American communities, and being able to provide these groups with internet service and then teach them how to use a computer, to be able to connect them with services that they surely need, but maybe don't know how to access. And that's the biggest thing. And that's the way people can help the most is if you have somebody someplace, you know, buy them a computer, have somebody go in and show them how to use it. You know, take that step to make sure that they don't lose contact with family members.
And it should also be said that I'd see Maurice and then Lenny, I'll just make an editorial comment here that healthcare providers need to keep in mind that they, to the extent that they turn everything into online access, they are excluding a significant number of older adults from accessing services. First Maurice, then Lenny, then you, Deirdre. Maurice, you.
Yeah, I think two things. I think that finally the walling in of people in long-term care environments needs to be torn down because we, in so many different ways, are a object lesson of what should happen and what can happen once people set aside their biases, their divisive opinions, the words they like to say anonymously on social media, and realize that they have things in common. You don't really care if you're in a wheelchair, trying to get to the dining room, whether or not the person who is in the wheelchair behind you believes as you do in terms of who won the 2020 election. All that matters is if someone else has your back. And we see this all the time in the larger community. Whenever there's a disaster where people drop race prejudice because a person from a different ethnicity is the one that rescues them. No one asks about sexual orientation when people are offering to help clean up the debris that was once your home, but is now a tornado mess. But we forget about those lessons. We in the nursing home community don't. We have strong opinions, but they're more, we realize that they need to be prioritized, that there's some things that matter. As one person used to tell me, don't sweat the small stuff, and everything is small stuff. And when you have to find ways to make sure that your medication is delivered on time, that you have enough linen, and that your emergency call bills are answered in a timely fashion, and that is universal across the community. You don't have time to discuss those things that divide you. And the second thing that I think will be helpful is time. The baby boomer generation is starting to get to the age where they're in need of skilled nursing facility care. These people have been active almost from the days before they had turned into adults. They have marched for gay rights. They have marched for civil rights. They marched for marriage equality. They have been active all their lives. And in addition to that, they know how to manipulate the system and how to fight their system. And so once they start to arrive, this patriarchal, arcane system that we have now in nursing homes and basically in the larger community will more or less be turned on its head and revolutionized. And I can't wait until they arrive, because instead of feeling alone as someone trying to make change, you will have partners. And this is going to be that way across the board. And I look forward to that.
Thank you, Maurice. We all need somebody who has our back. Now, I think Lenny, then Deirdre, then Hector. Lenny, you had something.
Yeah, I think that, well, person-to-person contact is protective. And when I think about the Geneva Convention, isolation is a form of torture. And I think a lot of people lived with isolation that was really, really threatening and dangerous to health, all kinds of health, mental health and physical health. My dad grew up, or my dad was served in Holland in the Dutch resistance. And what's similar for me between COVID and the war is that we're afraid, and that there are people we can give lip service to, but that we don't really help until we're ready to take some risks and willing to make some sacrifices of our own personal safety. And so I think we need to expand the meaning of love a little bit so that we're not just, so that we go deeper and that we're willing to actually make some personal sacrifices, commit some time and effort on the behalf of others who aren't as privileged as we are. I'm very aware of how privileged I am. And I have friends who are physicians who walk into their hospitals, but also people who, the janitors, the people who do the cleaning, the people who work in grocery stores. I mean, those of us who are privileged sometimes order, I know some of my friends order food in, and I think about the people who are working in the grocery stores who have to be there to protect their families so that they have some money to pay for the bills. And the distribution of care is so uneven. So I think we have to go deeper if we're going to have each other's back. We have to be willing to take some risks. And I think about people during AIDS too, people who didn't stay away from people who had AIDS, who walked into those people's homes and bedsides and took personal risks. So I'm promoting the idea of personal risk, and I would love to hold up those who have been the heroes, the courageous ones in the pandemic.
Deirdre, you and then Hector.
Yes, this is a concern, the healthcare. Now, I don't have a computer, and every time I have a hospital appointment, they want me to check in. And I don't know how to do that because I don't have a fancy phone. So they'll text me and tell me if I don't check in, they're going to cancel my appointment, which I don't think is fair. And then when I do get to the hospital, the doctor says, well, you should buy an iPhone. And I look at him, are you going to give me the money? The nerve. I don't understand the healthcare system anymore. We're seniors and some of us don't know how to use a computer or want one. And then we're threatened if we don't check in by a certain time. My appointment is canceled because they don't answer the phone. So that's very bad for me right now since I have heart trouble and high blood pressure. It's very scary now. Everything has to be technology. Why can't I just call you on the phone and ask for an appointment? It's scary now, being a senior and in this pandemic, a lot of people get sick. So that's one of my worries, one of my worst worries right now.
And you've had a lot of health issues recently.
Yes, and I'm still going with them. And I was told that I may need heart surgery within the next 2 months. And that's scary. If I don't click on, they're going to cancel my appointment. So yeah. I don't know. I'm not buying a computer. Can't afford it.
Yep, you're muted.
Sister just made my point. I think I wanted to follow up on my colleague's conversation about rural America not being electrified. At one time, LBJ, his first bill when he got to Congress was to electrify all of rural America. That was his claim to fame. But now we're more into the digital divide. And perfect example, I think I had mentioned earlier, connecting to the medical professionals. If you don't know technology, you're not going to be able to do it. I think that going forward, that every unit of government needs to come up with a plan on how to eliminate this digital divide, to expand that broadband so that not even in the inner cities, there's all the research indicates that they've lost the students. They don't come back because they were not able to learn remotely because they didn't have a computer. They didn't have a hotspot. Some of the kids had a phone, so they were going to like McDonald's to get the signal. So that is an issue that affects all of us.
Yes.
And I think some of the things we need to think about is how are we going to get the city, the county, the state, the school district, and all the other nonprofits hooked on and collaborate to resolve this. It's not just rural America, actually. We need to create the infrastructure, not only in the cities, the major and small and others, but rural America also. I think we need to concentrate on that. And it takes unity of all these, not only public, but also private.
So here's another question that's come in, going back to the personal. What have you learned about yourself during this difficult time? And what have you learned about yourself as a person who is aging during this difficult time? Who wants to take a crack at that? Janice, you're shaking your head. How about you start? Ah, you're muted. Muted. Okay.
Yeah, there we go. I think I've learned that I'm a bit more resilient and a bit more resourceful than I thought I was. I found an interesting quotation about resilience, which I thought was really appropriate for my experience, which is resilience requires facing uncertainty with flexibility. I'm really struggling, I guess, at this point to overcome some of my fears of getting out there. Like one of your other panelists, I'm also immune compromised, and so for me to put myself out there could mean that I would be susceptible to having COVID, and I really don't want to take a chance on what that would mean in terms of hospitalization. I think the image that I have of my dad, who was a smoker for many years of his life, so he developed all kinds of respiratory problems, and he died of pneumonia at the end of his life. And the thought of being intubated is like a fate worse than death for me. I mean, it could keep me up at night. So the kind of medical ways of keeping me alive, I guess, if I were to contract this condition, is really frightening for me. So I'm struggling with being out there, being courageous, putting myself out there. I mean, we walk, we exercise, I cook healthfully, we still see our friends, and we were volunteering, as Joseph said, at the local history center, and we've told the gentleman there that we'll be back in March. Hopefully, I just got a good report that the number of hospitalizations in Erie is really where it was in the fall, in autumn. So the numbers are coming down, but so I'm very much in process and still trying to overcome that fear of putting myself out there. Yeah.
Who else would like to talk about what you've learned about yourself and about growing older during this pandemic? Harold.
I would, Judy. You know, most of my life I've been like a rugged individualist type, hardcore, hard driving guy, self-sufficient and all that. But in our neighborhood during the pandemic so far, at least 3 people have died alone in their houses. These are people who had good careers, accumulated assets, enjoyed comfortable lifestyles, but they lived and died alone, sometimes having been expired for days before their bodies were found. You know, I think in our generation, boomer, I'm a boomer, obviously. We took the individualist philosophy too much to heart, not thinking about our antiquity, the time that we would become decrepit and feeble and dependent on others. So, in North Carolina, where I live, about 1 out of every 5 people over the age of 60 lives alone. And that's going to be a big problem, What I've taken away from the pandemic is that you can have money, but money can only buy what is for sale. In times like these, money may not buy the support and the services you need, because that support and those services simply aren't available. And there are things that can't be bought with money, things like love and devotion and trust and loyalty. Those things don't have a market price. So what I've taken away from this pandemic so far is an increased appreciation for the people who I know genuinely love and care about me.
Anybody else willing to weigh in what you've learned? Maurice?
I've learned that I have more coping skills than I realized. I remember once the pandemic began, the nursing homes were required to check our vital signs 3 times a day. This included temperature checks. And anytime your temperatures seemed to be a little bit above normal, you ran the risk of having to be taken up to the COVID unit and then tested to see if you had COVID. There was the one time when my temperature was above normal, and I literally freaked out. I wrote a rapid email to my sister, instructing her what to do with my finances, to distribute them between my mother, who was a senior citizen, and my 2 nephews. And I felt like inevitably I was going to die. I think that early on in the pandemic, the analogy with the HIV crisis is very accurate. Once you were diagnosed with HIV/AIDS, it was a death sentence. In the earlier days of the pandemic, once you got to the point where you were on a ventilator, there was pretty much no hope for you. Keep in mind that during the early part of the pandemic, George Floyd was murdered. And so the entire world was going up in arms and flames over 2 different issues. And I was sitting there freaking out. I didn't want to watch television. I didn't want to do anything. I didn't want to interact with anything that would put me close to either one of those subjects. Flash forward a few months later, I realized that I got COVID. I was okay. I made it through it. We are capable of doing that with other people. And I realized that this was just another thing that I needed to help people stay safe from, rather than fear. And it's a 180-degree turn for me.
Anybody else? Deirdre, I'm going to have to ask you to mute. Thank you. Lenny, what have you learned about yourself? You talked about going deep, and it's clear that you've been really, really thinking about your experiences during the war and a lot of other issues. You mentioned the book you wrote on groundlessness, and anyway, I'll let you.
What I've been reflecting on a lot is that love isn't easy. That I mean, sometimes we can be loving and it doesn't exact a cost from us. It's just pleasurable. But that there are times when love means that you do things that are uncomfortable, that require sacrifice, that require you to step out of your own comfort zone. And so I've been looking at how much of that I'm willing to do. I can see the times when I don't do it. And I can see and feel glad the times when I am willing to do that. And I don't know, spirituality is an important thing for me. And so in many ways, this feels like the deep lessons that I've been confronted with during COVID, and that they're universal, they're existential questions. So it's taken me to that realm.
And another question similar to, but a little bit different, is what has made it possible for you to deal with the adversities that you've experienced, with the hardships of this time? What strengthens you and most supports you? And let me ask Hector, do you have a thought about that? Unmute.
I'll tell you one thing, that seeing my wife and having to care for her, and when somebody has a cord attached to her to oxygen, and I see her suffering, and helping her and making her smile makes me smile. But also getting reports of my grandkids overcoming COVID, the ones that have also suffered that, and overcoming the disease, and their success in school and in life over the last 3 years. Two in college, two about ready to go to college, planning careers. I try to look at the positive stuff. I try not to look at the negative stuff normally. I'm happy that I'm still alive at the age. I'm going to turn 80 next month, and I'm still pretty mobile. I accept my limitations. I can't walk and run like I used to. I played a lot of baseball and soccer, but my mind is still pretty active. I'm able to use technology to the best of my ability. All those positives give me hope. I know I want to live every day like it might be my last one. And I thank everybody that helps me continue my life as if it was the same life that I had before. And that means my friends, that means my wife and my children and my friends that I'm close to, even if we do it sometimes now remotely. I think it inspires me to continue living.
Chuck, I'd like to hear your thoughts, especially because you had told me, and Hector, you might want to mute, that you feel that you've gone downhill over the past couple of years. So what keeps you going? What lets you cope? What makes it possible for you?
I think my connection with other people. We have a Zoom for people living with dementia here in Nevada on Mondays and Fridays. We have probably anywhere from 20 to 30 people there. And we talk about everything. We talk about what people are afraid of. We talk about what people, don't want to see happen. And it's such a nice exchange of information back and forth. And it's always done on a positive floor that people can ask anything. Because we found out with dementia does not care who you are. It doesn't care what color you are. It doesn't care what religion you are. It doesn't care how much money you make. It cares about nothing. And so the way I look at it is I have my dementia family, and we're all going through the same thing. We can talk about it. And a lot of times they're able to talk about things with us that they're not even comfortable talking to their care partner about. If you could imagine somebody coming to you and talking to you about something they did the worst day of their life, and be able to be accepted and say, something I've had that same issue with what I've done, and what dementia makes you do. So I think that the positive connection with the people that I've met, and I learned early in this disease that by helping a single person, that gives me the energy to get up in the morning and to put a smile on your face. Because I see too many people that have the mentality of, well, you know, I shouldn't do this and I shouldn't do that. And my family tells me I can't do this. So, you know something, I'm just not even going to try. And change that to, you know something, I want to do this. Now let's figure out a way how. Who was it? Walitha, you know, when having a barbecue at a rest stop, that's figuring out how. That's having that mentality. And we can share that with other people and say, you know something, this is what we did. And this worked. Because dementia is something that is different for every single person. So what works for me may not work for somebody else. You know, and what works for them may not work for me. But to have that, to be able to have that, the conversation of, you know, I feel better today because I talked to those guys this morning and they're going through the same thing. And maybe it brings up the point of risk reward. You know, with me, I'm kind of like Tom, I need to be out. Bobby and I have always been out. So if we want to go someplace, you know, we say, well, you know, do we really want to go here or can we do this? You know, and we're always talking and we're doing. And if we want to go to the casino, we mask up, we go to the casino. If we want to go bowling, we go bowling. I'm very fortunate. I love to play golf. And I have 4 gentlemen that I play golf with. And we're able to talk back and forth. So having the ability to talk with other people, I think is so important. And to talk on everybody's level, you know, don't talk down to somebody, don't talk up to somebody, talk to them. And it's amazing what happens when you start talking to somebody. The relief sometimes. I had a lady, she's an African-American lady that ended up playing golf with us one day. And she was kind of standoffish and didn't want to talk. And she heard me talking about dementia. Come to find out her brother had just been diagnosed the week before with dementia. And we spent the entire rest of the round of golf talking one-on-one of what she was afraid of and how could she get this help and how could she get that help. You know, all it takes is for somebody to break the ice and say, hey, how you doing? What'd you like to talk about? And I think that's what I've learned so much from the last couple of years.
Tom, you had your hand up. What's helped you?
I have always been a fairly positive person, and it has been difficult for the last 2 years to be positive. You really have to make a concerted effort to look at the glass as half full and not half empty and on its way out. I was a supervisor of social work in the Philadelphia prison system for 29 years. So I saw a whole part of the world that was not so positive. And I used to tell people, unfortunately, I was constantly reinforced by my failures because I would see them over and over again. And the successes I never saw again. My wife and I are lucky to be able to make contributions to social service agencies and other nonprofits to help ameliorate some of the issues that other people have spoken about. And I try one-on-one to treat other people the way I'd like to be treated myself. And just being positive and treating other people fairly, I think, can go a long way toward helping you through pandemics like this.
Deirdre, you just waved your hand at me, but then you disappeared from the screen. Do you want to say something about what's helped you during this pandemic? Oh, maybe you were waving goodbye. All right, here's another question that came in. For young people who want to help support older adults, but aren't sure how to ask whether they need help, or how to interact with them. Do you have any advice? Okay, Chuck.
I think it's extremely important to have family conversations. You know, let people know what you need. Let people know that, you know, maybe that you are struggling, but the conversation has to be ongoing through the entire family, because stress like what we're going through affects everybody in the family, from the children all the way through the senior adults. And if you can have open lines of conversation, well, you know, well, I don't like people doing this because of this. And you can say, okay, well, what if we do this? You know, and work around the person, because my outlook is for people with dementia. People with dementia may not understand what they need. You know, they may have done something this way their entire life, but if you can help them continue to do that, even maybe in a different way, because everybody has to be able to do something they enjoy, something they love to do. And too many people just stop doing it. And if you can figure out ways to continue to do it, even though it may be a little bit different, I think that's what people need to understand.
Okay, we only have a couple minutes left, so I'll just throw it open. And what are you hoping for in this new year? A couple of answers, and then this wonderful session will be done. Who wants to take it on? Walitha, how about you? What are you hoping for?
Well, I don't think that we can plan for every eventuality, okay? So it's not really about pie in the sky for me. I'm hoping that we can all come to a realization of, you know, what would be best for all of us, all right? I'm just hopeful that we could be a little less selfish, okay? Because we all have to exist, all right, in this world together. So that would be very important to me.
I think we may have time for one or two more answers. Let's start with one. Who wants to take it on? Maurice, but make it short.
It goes back to the issue about youth. And I think that one of the things that would be very helpful as the population of staff ages out or burns out in terms of nursing staff is for youth to get involved in this field. It will be the lousiest job that will ever touch your life, because you will be saving people's lives, and you are going to be probably the face of the revolution, whether you're inside a nursing home or whether you're assisting people in making appointments when they come to their doctor's office. And I think the more the young people get involved and say, I don't need the big money, I need to help people, the better off will I be.
My watch says 11:30, but I think we might need time to close this. Unfortunately, Lenny, I see your hand up. Thank you all for what has been an extraordinary conversation. I'm going to be sad to end this. And thank you to our viewers for hopefully learning more about what's really important to the panelists who have joined us here. Over and over again, I hear social, personal connections, generosity, the sense of having our back, of reaching out to others, of acknowledging what we can do, not what we can't do, and helping make that possible. Those are all guides for the future as we move forward here. Thank you all. Bye-bye.